background for those of you who are probably hearing about CSI maybe for the first time or maybe the second time. Our origins go back to 1963 when the Reverend Robert M. Howes created Community Child and Family Guidance Association, CSI's founding organization. We are so pleased that Reverend Howes, our agency founder, and his lovely bride, Christine, could be with us this evening. And I wonder if you would like to say a few words, Reverend Howes. I know you have a lot of friends and a lot of fans who'd love to hear from you.
Everyone there?
Welcome, everybody. I don't know how to use these very well, so I hope you're hearing me. It's a great pleasure, really an honor, of course, to be here this evening and to be recognized as having something to do with the early development of mental health therapy in this part of Maine. I think it's important to tell you that there were others too, and I suspect that I'm the sole survivor. I hope that you're all having a lovely, joyous evening. Christine and I are certainly enjoying being here, and we feel honored to be part of this annual celebration in honor of the folks who so wonderfully and skillfully provide the necessary assistance for folks who have mental health issues with which they need help. So with that, I simply say that I think it's a wonderful evening. I hope you all have just a marvelous time. I know we are. And it's a pleasure to be with you. Thanks.
I hope this is helpful. Now we'd like to move on with some other community recognitions. We'd like to present our KUDOS Community Awards. This is the first time we have given these awards, and they really truly were inspired by the commitment to community service that we see here in the Sanford Springvale area. We received a large number of nominations, which made it difficult to narrow it to 3 awardees, but feel that tonight's winner really are standouts, and I'm sure you will agree with me. All of tonight's awards feature original artwork by someone associated with CSI. The KUDOS Community Awards were created by a participant in CSI's Life Enrichment Program. And this year's Visionary Award is a creative work of the program's director and chief instructor, Patricia Rimmer. Are you here, Patty? I saw her earlier. So there she is. Thank you. What you will notice with the artwork, as much as you did with the exhibit here this evening, was inspired by Vincent van Gogh's famous Starry Night painting. We know that Van Gogh is a tormented soul and probably suffered some form of mental illness. He created Starry Night near the end of his life when he had committed himself to an asylum in the southern rural area of France From what I know of him, I suspect Van Gogh would be happy that his mesmerizing artwork, which was ignored and despised in his lifetime, is tonight the inspiration to recognize the unique contributions of people who advance human kindness in the world. So helping me in presenting these awards are two very special people that I'd like to introduce to you. They are Sylvie Demers. Sylvie is the regional director of our Springvale office, and following Gimpy behind her, but that's not very nice. Denise, we have a long history, so I think she'll let me give you that allowance. Denise Day is her local business partner in this area. Just to tell you why this is important, several months ago we reorganized CSI and into our different regions. We have a significant presence in the Saco-Biddeford area, in Westbrook, Kittery, and here in Sanford Springvale. And what we have done is identified and provided folks like Sylvie and Denise so that you would have a face of CSI within the community. They work with the local leaders and stakeholders to improve the health of the community. So on with the awards. I'd like to begin with our first award, which goes to Sanford Police Chief Thomas Connolly Jr. As our crisis staff and clinical staff would say, he really gets it. The chief understands that law enforcement and mental health agency must have an intimate, close working relationship to do our jobs. He puts this knowledge into daily operation. Chief Connolly, like very few small city police chiefs, takes an innovative, progressive approach to law enforcement training and practice as it relates to mental health. His officers have received crisis intervention training from CSI over the years. And the chief has instituted policies and procedures that aim to diffuse crises and lessen confrontations with people who are suicidal or who are suffering from mental illness. So Chief Connolly, for being an innovator and a role model in your profession, we proudly present you the KUDOS Community Award. Would you come up and receive? Would you like to say something? I don't want to hear the words. You're under arrest. Our second community award goes to Dr. William Chernin. Also a role model, Dr. Chernin is the epitome of a community physician. One of our clinical staff nominated him for this award, and about him she said, and I have to quote, "His CSI patients appreciate him greatly. He works for Goodall Health Partners, which is one of the few medical practices that take Medicaid, so our clients are his patients. This means that Dr. Kernan sees patients not only with chronic pain, obesity, diabetes, but also poverty-stricken mental health clients, many afflicted with substance abuse. He makes referrals, and he can be consulted as needed." She ends her nomination narrative with a question. Do you know how rare it is for a primary care doctor to call a patient's therapist? I'm sure it's rare, but obviously Dr. Chernin does. So Dr. Chernin, for treating our patients with compassion, for communicating effectively with our staff, for bringing all the best attributes of a small-town doctor to our clients and residents of Sanford and Springvale, we would like to present you with this award this evening. If you would join us and receive the award. Community Award goes to McDougall Orchards, an iconic family farm for 7 generations, now owned by Ellen and Jack McAdam. Ellen tells us, again I quote, "Community service, whether to the nation, to the state of Maine, or the town of Sanford, has always been an integral part of our families and business over the years. Jack and I have been able to succeed in our endeavors by tapping into the momentum created by the local foods movement and increased public awareness of the value of local agriculture. We never forgot how fortunate we are to live and work on a beautiful farm in Maine, and we both feel the need to support the community that supports our business." McDougall Orchards has also been very supportive of CSI Social Club here in Sanford, whose members love their annual visits to the orchard to pick apples and other delicious fruits and vegetables. So Jack and Ellen, for being a business with a strong community connection and equally strong social conscience, we would love to present you with our award. If you would come up, please, and receive it.
Did you do that?
We couldn't do this without these two right here, Pat and Robert McDougall.
Now for the moment we've been waiting for. We would like to present CSI's Visionary Award, and I'd like to ask John if you join me in doing this one. The award is named, just again to give you a little background, for our esteemed founder and remarkable vision. The Reverend Robert M. Howe's Visionary Award also highlights CSI's unique vision to create and deliver innovative mental health programs. I can think of no person more deserving to receive this award tonight than Robert Kreider. Barbara is the Executive Director of the York County Community Action Corporation. Her organization's mission is to alleviate the effects of poverty and has been delivering a range of social service, health, and educational programs to thousands of children and adults living in poverty since 1965. In short, York County Community Action Corporation manages to meet a remarkable number of social needs, from shelter and heat to health care, nutrition and exercise to legal assistance and advocacy, early childhood education and home buyer education to emergency assistance, and the list can go on and on. Only a truly remarkable person could head up such an organization, and Barbara Kreider is truly a remarkable person. We know her well at CSI because in her former life as the director of the health center, Barbara was instrumental in fostering a close collaboration of mental health services with CSI. Barbara is a strong advocate for Maine's underprivileged and a catalyst for positive change. She honors CSI by allowing us to honor her for her dynamic leadership and vision that significantly improves the quality of life for many of CSI's clients and for the residents of Southern Maine. It is with great pleasure that I ask Barbara Kreider to come forward to accept the 2012 Reverend Robert M. Howe's Visionary Award.
Well, obviously, I'm very humbled, and I want to thank CSI, its board of directors, and all of its staff. It was a few months ago that Janine LePetrie and Lois Jones called me and said they wanted to meet with me. And I've been around the barn long enough to know that when Mother Superior and the principal, it doesn't bode well. So I spent several kind of nervous days thinking, what trouble am I in now? So you can imagine my surprise when they came to inform me that I had been nominated for this award. And I just want to make it clear that though I'm the one who is named, I'm accepting it on behalf of your county community action. And I'm so very proud to be part of that organization and have been for some time. At Community Action, we pride ourselves on being client-focused and mission-driven. And several of our senior staff members are here with me who have been the heart and soul of the organization for many, many years. And no one works harder to make our communities a more healthy and prosperous place for the vulnerable. And so I accept this on their behalf as well as my own. And I also want to point out that our board chair, Claudette Dupuy, is here tonight, and as well as Lois Jones, who is the principal at CSI, and also served on our board of directors. But the leadership of the board is what has made it possible for our organization to do the good work that it does over so many, many years. So I want to recognize the board, and Claudette in particular, because she served as our board chair for many years. I know that the prior awardee, last year's awardee, had of this honor, had written a book, and I don't want to disappoint you, but I have not written a book. So I thought, well, I'll do the next best thing, I'll read a book. And I did. And I knew that the theme of this evening's event was Starry Night, inspired by Vincent van Gogh. And so I read a biography of Van Gogh, recently published, and I can't remember to the authors, but it just came out. It's a marvelous book. It's easy to read, very well researched, and I have to say I didn't know all that much about Vincent van Gogh prior to reading the biography. Of course, I knew what Don McLean told us, and I knew about the ear. And I also knew that he had produced just extraordinary works of art that are treasures. And I've had the privilege of seeing some of them in person, and it's just an astounding experience. But I didn't know the depth of his suffering or the despair that he lived through. He was incapable of keeping a job for his entire life, basically. Even after losing positions that his family had arranged for him time after time after time, he would work just for room and board, and even then he was asked to leave. He even went in his middle 20s, and he became an evangelist, and he served this desperately impoverished mining community, and obviously was not making a lot of money, but even they petitioned the superiors to have him removed because he was incapable of holding these positions because of the mental illness that he suffered from. His family suffered as well, obviously, and I know that everyone in this room has been touched by a family member who has been challenged by mental illness or substance abuse addiction, sometimes with tragic results. And there was a really rather poignant line his father wrote to Vincent's brother Theo when Vincent was still quite young, and he said this, he said, "We are more and more worried with time, and we fear that he will become unfit for practical life. It is bitterly sad." He was abusive to himself. He went without food. He would walk obsessively for miles and miles, 10, 20, 30 miles in a day, often without adequate clothing against the cold. He would punish himself. There was a rather notorious incident where he held his hand over a fire, a candle and wouldn't stop. He would sleep sometimes on the floor. Because he didn't think he deserved a mattress. And I mean, he was an absolutely tortured soul. We treasure his extraordinary artwork, and it's sad to note that he took his own life when he was only 37 years old. I think what we need to remember tonight is that there are Vincent van Goghs among us in our communities, you know, and in our families and our neighbors. And not to be maudlin, because we're here to celebrate. And what I think we need to recognize is that in the greater Sanford-Springvale area, because of the leadership of a lot of people, we've achieved extraordinary things. And we have been able to weave a safety net that Vincent van Gogh didn't benefit from. And I want to recognize some of the leaders, obviously CSI, and extraordinary leadership. Our own organization, I think York County Community Action, not because of me, but over the years, we've made a significant contribution. Goodall Hospital and the emergency department staff and Patsy, under her leadership, Chief Connolly and I were at a meeting a couple of weeks ago, and emergency department nurses were at the meeting, and I was so impressed with how compassionate these people were, some of who I see now, in treating people who come into the emergency department because of a psychotic episode or some sort of psychological or psychiatric crisis. Chief Connolly has been extraordinary, as you know. York County Shelters provide shelter and treatment to some of the most vulnerable. Faith-based groups, United Way, private practices like Dr. Chern's, and the community-invested private businesses like the sponsors tonight and McDougall Orchards. You know, all of these folks we have worked so hard to make this community a place that is caring for the most vulnerable, and we've achieved extraordinary things. And I think we all deserve to be proud. We have a lot more work to do, but we have made a safety net, and we deserve to be proud of that. Now, I want to say one final thing, and not as the director of York County Community Action, but really more as your neighbor, I guess. You know, there's been a lot of wrangling with the state budget and a lot of concern about the inability to provide care for people who are very, very vulnerable. And I think most of you know that the governor vetoed 2 provisions of the recently passed budget. And I'm not here to get political, and I'm not going to give you an opinion one way or the other, but I think it's instructive to look at part of what the governor vetoed was funding that would have provided positions to help vulnerable individuals who are very likely eligible for either SSI, which means access to health care, or veterans benefits, which means access to health care, and without which they would not have access to health care, and they wouldn't have this treatment. So I want to read for you the rationale behind the veto, because I think it lays down a challenge for us. This is a quote, reason. This proposal anticipates reducing costs in our general assistance welfare program by shifting people to a different welfare program. This is not welfare reform, it is simply box shifting. I do not believe that the solution to Maine's high welfare costs is to send the bill to Washington, D.C. We must promote self-sufficiency for Mainers and the state alike, and not more reliance on federal government. Now, I think that all of us in this room need to take the challenge, because our leaders need to understand that SSI, meaning access to health care coverage, veterans benefits, access to health care coverage, means treatment for people who otherwise would not have it. And I think we have an advocacy obligation as people who care about our communities and about the most vulnerable members of our communities. And I think we need to educate our decision makers about the ramifications of the decisions that they make. Vincent van Gogh didn't need a stern talking to. He got that from his father, his uncles, his brother. He needed treatment. And so I just leave you tonight with a challenge that I hope you will take up and join us in the good work that we've already done, and continue to educate our decision makers and advocate for access to treatment, because people who suffer from persistent and severe mental illness, if they get treatment that is adequate, they are productive and contributing members of society. And we owe it to them to continue to advocate as we have. So, thank you.
Thank you, Barbara. You constantly amaze us with your energy. You inspire us with your passion. Humble us with your humility. And elevate us with your vocation. In your honor, and in the honor of our 3 Community Award recipients, we have a little entertainment. Don Miller, here to my right, and his wife Jennifer will perform Don McLean's beautiful tribute to the creator of Starry Night.
Starry, starry night, paint your palette blue and gray. Look out on a summer's day with eyes that know the darkness in my soul, shadows on the hill. Sketch the trees and the daffodils, catch the breeze and the winter chills in colors on the snowy land. Now I understand what you tried to say to me, how you suffered for your sanity, how you tried to set them free. They would not listen, they did not know how. Perhaps they're listening now. Starry, starry night, flaming flowers that brightly blaze, swirling clouds and violet haze, reflect in Vincent's eyes of china blue, colors changing hue. Morning fields of amber rain, weathered faces lined in pain are soothed beneath the artist's loving hand. Now I understand what you tried to say to me, how you suffered for your sanity, how you tried to set them free. They would not listen, they did not know how. Perhaps they'll listen now, for they could not love you, but still your love was true. And when no hope was left inside on that starry, starry night, you took your life as lovers often do. But I could have told you, Vincent, this world was never meant for one as beautiful as you. Starry, starry night, portraits hung in empty halls, framed on nameless walls, with eyes that watch the world and can't forget, like the strangers that you've met. The ragged men in ragged clothes, the silver thorn of bloody rose, like crushed and broken on the virgin snow. Now I think I know what you tried to say to me, how you suffered for your sanity, how you tried to set them free. They did not listen, they're not listening still. Perhaps they never will.
Beautiful. I should mention that the proceeds tonight are going towards support of the CSI's innovative mental health programs, our complementary therapies program, which is a hands-on healing, and our life enrichment peer support program, which is a hands-on therapy, art therapy. Both of these are supported solely through personal donation and grant funding. So thank you all for your generosity this evening. So again, thank you so much for being here and being a part of our evening, and we hope to see you next year. Thank you.